I have relapsing-remitting multiple sclerosis. I was very isolated. I had issues with my bladder, my bowel. I also developed right side weakness in my arm and my leg. I initially felt some slight improvements with my bladder while I was at the clinic. And another improvement, which started around month 2, was my hand. I can lift the shopping bags, which I couldn't do. Around the third month, in the third month, I started to breathe much better. This is my second visit to the clinic. I've come here because I got very positive outcomes from my first visit.
Good afternoon. Would you please tell us where you're coming from, what's your name, and what brought you to Swiss Medica?
Hi, my name's Kemal Nami. Good afternoon. I came in from the UK. I currently live in Cambridgeshire, the United Kingdom. This is my second visit to the clinic. I've come here because I got very positive outcomes from my first visit. So I came here with the intention to consolidate those positive outcomes and hopefully get even better progression in a positive way.
Have you mentioned your diagnosis? No, I think
No,
you haven't.
no.
So what is your diagnosis and what kind of challenges do you face in your everyday life being diagnosed with this?
Okay. I have relapsing-remitting multiple sclerosis. I was diagnosed 10 years ago in 2014. I had my disease activity was quite well because I was managing with lifestyle interventions. Then following a very stressful period, I had a couple of relapses, and that impacted on my quality of life, on my normal daily living. I was very isolated. I had issues with my bladder, my bowel, toileting issues, which were very excruciating. I also developed right side weakness in my arm and my leg, predominantly in the arm. And in addition to that, which was the major concern for me, I had respiratory issues, breathing issues, irregular breathing, hunger for breath, shortness of breath. So it was very difficult for me to go out. I was always in constant pain. I was very anxious about my future. So I had to do something about it.
So how did you come up with the idea of trying stem cells with MS?
Well, there's a lot going out there about the stem cells, mesenchymal stem cells. I started doing my research. I started to look at a lot of the clinical trials, and it made sense to me. Predominantly, I found about the safety of it. So once I got around that it was a safe procedure, I thought I might give it a go to see how I can benefit from it, and if I would benefit from it. I had the anticipation that I would benefit because I've been following a very healthy lifestyle, so I had less deterioration compared to maybe other MS patients. So that was my hope when I was coming here.
What kind of therapy did you have then back home from the doctors?
I was on the latest disease-modifying therapies, a therapy called Kesimpta. It's a monthly injection that I do self-administer. It's one of the new therapies. It did help to stabilize my disease activity to a certain level, but I was constantly having episodes where I was still having serious symptoms. So it didn't help me in regard to my daily living and the quality of my life.
Have you mentioned to your neurologist that you were going to perform stem cell therapy?
Prior to coming here, I didn't tell them because it's my decision. It's my life. As I mentioned, I didn't want to be influenced in any negative way because I know everyone has their different opinions. But I did share the outcomes and the discharge notes which the clinic Swiss Medica provided for me, and I sent it all to them, and they were satisfied with what I sent to them.
So there were positive comments?
They were positive. At first they got afraid. They thought that I had there's two types of stem cells. They thought I had the AHSCT, where they wipe out your immune system with chemotherapy. So they got alarmed. They thought that I should stop my therapy straight away. But then when I informed them and sent them the paperwork, which is very detailed, that I got from Swiss Medica, they were satisfied. And they were even happy. My MS nurses were happy about the positive results.
After you left the clinic for the first time, how long did it take for you to feel any changes?
I initially felt some slight improvements with my bladder while I was at the clinic. So, like when I was traveling here, it was very difficult for toileting issues. But on my way back, it was much more comfortable. It wasn't perfect, but I saw some improvements with the bladder first. And I assume that the physiotherapy also played a significant role in that, particularly the Emsella chair. Following that, I saw some improvements at month 2. My bladder continued to improve at month 2, and then my bowel, because I had difficulty in releasing my bowels, constant constipation. I always had an urge to go to the toilet, but nothing was happening. And so that started to ease around month 2 as well, which kept on improving until month 3, where it's now at a point where it's more manageable. I've got more control of my bowel and bladder now. And I also had a lot of issues regarding balance, which also brought some nausea. So I used to have some falls up when I was going up and down the stairs. So that also resolved within about 2 to 3 months. But my main concern was my breathing, because I always say breathing is life. And I didn't see an improvement initially from that. So that was kind of a concern for me. But around the third month, I started to breathe much better. And that continued, and now it's almost near normal, my breathing. So that was kind of very reassuring for me. And another improvement, which started around month 2, was my hand. I had problems with my grip. I had issues with my finger dexterity. I couldn't lift heavy things with my right arm. I had issues like when I was doing buttons and that was hard, or when I was doing fine issues like cutting things and that I had to be very mindful. So I saw some improvements in that, and that was very tangible and very reassuring for me. Now I can lift things when I go to grocery. I can lift the shopping bags, which I couldn't do. I could only lift a few things that were up to maybe 1 kilo heavy, but now I can almost lift as normal as my left arm. So that was very encouraging for me as well.
So it looks like it improved the quality of your life.
Massively.
Yeah.
Immensely.
Great. Would you please give some comment about our medical staff? If they're competent enough and educated enough to perform this kind of...
They're not just competent, and they're more than that. They're very professional. It's very clean, very hygienic here. The team are fascinating, from the cleaning staff, the kitchen staff, the nurses, the administrators, the doctors. They're all caring, you feel it, you can see it in their face. You get that human touch when you're being cared about, and that's very reassuring. And that made me feel very confident to come back. Not in addition to the positive outcomes that I got, also the approach that the clinic has and the staff, it made me feel at home when I'm here.
We have noticed that some of the people, from some of the patients' comments, that they had a fear coming to a foreign country. What about you? Did you have fear coming to Serbia? And if you did, how you overcame this fear? And what can you tell the others now about Serbia?
Well, I didn't have a fear about Serbia in particular, but I had a fear about the treatment. I had a lot of question marks because it's experimental, but it's been experimental for a long time. So I had to get my head around that. So I was a bit frightened, and I didn't know what to anticipate, to expect. But once I was here, that dissipated immediately. Once I saw the approach, the people's reactions, and the way that they treated me and they cared for me, the professionalism, was very reassuring. So what I can say to people is that in regard to a clinic, it's a no-brainer. It's a no-brainer. Swiss Medica here, the people here, the staff here will greet you, they'll accommodate you, they'll make sure that your dietary requirements are met. Like, I've got a very particular diet, and they've been very accommodating for that. They always update you and inform you, keep you up to date in regard to the procedures, and it's very thorough. All the paperwork is provided, all the certificates of the stem cells are provided. It's all very thorough, all very professional.
Kemal, any piece of advice you can give to people out there having the same health issue and hesitating or maybe considering coming for a stem cell therapy?
I always say to people, because MS is a very devastating condition. It has a very detrimental impact on people, on their lives, on their families. So do whatever it takes. Do whatever it takes that you believe that will make you feel better. Do it before you have further deterioration, because I do believe that you would get better results.
Thank you, Kamal.